Long Beach City, California is a diverse coastal community made up of 500,000 people, located in Los Angeles County. Community health focuses on the physical and mental well-being of the people in a specific geographic region, in this case, Long Beach, California. It is the intersection of healthcare, economics, and social interaction. One way community health is measured is using life expectancy. Life expectancy is the average period of time an individual is anticipated to live. When comparing Long Beach zip codes on the east side have higher life expectancies than zip codes on the west side of Long Beach.
We analyzed the social and economic disparities that result in the differences of life expectancy in both Long Beach and globally, with a close focus on diabetes and STIs. With unemployment being a large factor that affects community health, we look at unemployment in Long Beach. Most unemployment is concentrated on the general west side, with higher concentration in the northwest. In the same areas with higher unemployment rates, there are also higher concentrations of Latinx and Black folks. This is to say that unemployment has a larger effect on these communities. It's important to understand the economic disparities and its domino effect on the lack of equitable accessibility to basic needs. In Long Beach, we saw this to affect accessibility to nutritious and affordable food, leisure time for personal care, and medical care. Longtime resident of West Long Beach, Juan, shares his concerns with us saying, "People are living paycheck to paycheck. Nutrition is not going to be as great as neighborhoods with higher income." Juan clearly highlights the economic disparities of accessibility to nutritious and affordable food due to wages, thus expanding beyond the issues of unemployment on the west side. Juan shares there's not many perks in Long Beach, and with most people working full-time jobs in his community, they often don't have the time to enjoy the few green spaces that are available.
Violence and safety are also factors that affect the health of many residents in a community. In Long Beach, there are high rates of homicide, gang violence, drug and alcohol abuse. Violence in the community affects the lifestyle choices members make, such as avoiding taking kids to local parks if there are high rates of crimes in the area. When interviewing community members of Long Beach, we noticed that violence and safety tended to be common topics that naturally came up in conversation. From Jenny Non, we asked if she feels safe in her area. From Avante Kelly, we asked, how can community health be improved in your community? Accessibility to healthcare is a problem for people of color with low-income backgrounds. Less than 10% of the population have health insurance in Long Beach. This has led to significantly lower levels of yearly doctor visits, along with the cultural and language barrier associated with Latinx and Black communities.
A large percentage of low-income communities in Long Beach don't have medical insurance. The language and cultural barriers don't help people feel safe or like they can trust the physicians. The stigma within Black and Latinx communities on STIs and not having enough information on the health services provided in the area are all issues within the healthcare system.
Diabetes impacts many countries globally, even in the most developed countries. Within Long Beach, one of the 4 leading causes of morbidity is diabetes, with Black and African Americans being the smallest population, but with the highest rates of diabetes.
According to the World Health Organization, 1 million STIs are acquired each day, contributing to this health crisis. STIs is a public health crisis in Long Beach because of its increasing rates within the last decade. STIs has the highest rates in areas that are predominantly inhabited by Latinx and Black folks, which also happen to be the lower income areas. The 3 STIs that are affecting people the most are gonorrhea, chlamydia, and syphilis. Different ways in which Long Beach is combating these issues is by creating more educational programs such as the YMCA, offering free drive-up testing services for STI screening, and implementing ways to improve street infrastructure.
In addition to the city's solutions, we propose new outreach strategies to promote their programs, as well as investment in community spaces by and for the people, where community members can shape their educational curriculum, including health education, and plan collective activities to promote physical movement and nutritious eating.
Thank you for watching.
Made possible
by Frida,
Karen,
Lianna, and Jenny.